I think I may have some network issues, Prashant. I'll just move to another place.
ठीक है चलेगा नो प्रॉब्लम yeah.
My voice is clear, Prashant?
Yes, it is clear, you are visible. In case if your voice is not clear, I'll ask you to I'll interrupt and then I'll tell you the voice is not
All
clear. So we are live right now, so I hope you guys can see me, hear me properly.
Yes,
Let's
Prashant. Totally.
yeah, perfect, right? So we will start in some time. Just give us 5 more seconds. Okay. All right. So we'll start now. So good evening, everyone, and welcome to the another workshop by Blue Circle Diabetes Foundation. This is the workshop that we conduct every Sunday at 5 p.m. sharp, and we come up with different new topics. So that's one part. Second, introduction of me. Myself, I'm Prashant Divedi. I have been type 2 diabetic from past 12 years, a secondary diabetic where I take insulin and medicines as well. So that's a short introduction about me. And how did it happen? It happened to me because of acute pancreatitis. So that was one of the reasons I got diabetic. Moving ahead, we have Dr. Pooja over here with us, and we have Ketki as well. So, hello, Dr. Pooja. So, I will just introduce Dr. Pooja and her background, and then I will roll the ball to Ketki, and then she can introduce herself, and then so and so forth. We can start. Okay, perfect. All right. So about Dr. Pooja, she has completed her bachelor's in physiotherapy in 2012 under Maharashtra University of Health Science and fellowship in sports rehabilitation under Apollo Hospital Education and Research Foundation in 2014. Continuing her medical education under IGNOU in 2020, she completed her PG in environmental and occupation specific musculoskeletal and joint disorders. And she has worked with Surano Hospital in Malad West in Mumbai and Dutt Maternity Hospital in Goregaon, which is also based in Mumbai. She has her own clinic and she has been practicing from past 10 years now. And I'll this is all what Dr. Pooja Gandhi does. And moving ahead, I'll pass on to Ketki. Ketki, why don't you introduce yourself and then you can start with the questions.
Sure. Thank you so much, Prashant. Good evening, everyone, whoever's joined the session. And hello, doctor. We are so glad to have you here.
yes,
I
yes.
am
Good
Ketki.
evening.
Yeah. I am a type 1 diabetic. I've been a type 1 diabetic since 18 years. I've recently had my 18th anniversary of diabetes. I was 10 years old when it happened, and I am on insulin 4 shots a day. But yeah, that's about it. I work with Amazon in Bangalore. Nice
Okay.
city. You can see me wearing sweaters in like Bangalore is really cold right now. So looking forward to this session because we saw in the background that a lot of people were saying कि कैसे उन्हें ये frozen shoulder की तकलीफ है for some time. Folks will try to keep the session a mix of Hindi and English. I think Prashant, Dr. Pooja, and I can help you with multiple languages. If you have any doubts or anything, you can just post in the chat box. But thank you for being here, ma'am. And should we move to questions, Prashant?
Yes, yes.
Yes, not a
Most
problem.
certainly.
Awesome.
Thank you. Thank you so much for having me here, Prashant and Ketki.
Welcome.
All right. Moving ahead with the questions. I might have to pause you in between just for a few seconds because I might have some issues
No
with
problem.
mic.
Yes.
I'll just let you know in a second. You can proceed.
Okay, perfect. So if we can't hear you, we'll just let you know so that you can disconnect the headphone or however you wish to do it. Okay.
Sure. All right.
Back to you,
Great.
Ketki.
Thank you. First things first, ma'am, could you help us understand what is a frozen shoulder? How should we identify that we have a problem like this? किसी को कैसे पता चलेगा इसके क्या symptoms है क्या तकलीफ होगी किसी को?
See, first of all, shoulder or adaptive capsulitis is what we clinically tell as the term which is normally used by the doctors. It's uh, something related to pain, stiffness, and mobility in your shoulder joint. Now, shoulder joint itself is a shoulder complex. अभी आप ये नहीं बोल सकते हैं कि वो खाली हमारा ये साइड वाला जॉइंट है. सो शोल्डर कॉम्प्लेक्स इज कंसिस्टिंग ऑफ मल्टीपल जॉइंट्स. उसमें एक जॉइंट हमारा होता है जो ये साइड वाला जॉइंट हम कॉमनली रेफर करते हैं एज शोल्डर जॉइंट. So yes, if a patient comes to me with pain or stiffness or difficulty in raising the arm up, especially the rotations are restricted, which involves moving it outwards, moving it behind. So those are clear indications that the patient is definitely suffering from some stage of frozen shoulder. So most of need to clinically do anything apart from our examination and special tests जो हमारे होते हैं, जो हम examination के time पे ही patient पे perform करते हैं, to check the various angles and ranges of motion, which pattern में they are limited. That itself gives us a very clear idea कि the patient is suffering from frozen shoulder. So it is as simple as that. हाँ, अगर patient को खुद से पता लगाना है, then many times if background is there, आपका कुछ existing idiopathic conditions अगर है, otherwise if you're suffering from some shoulder injury or some immobility for a long time, या फिर आपका कुछ rotator cuff tear हुआ है, so you know, or you're suffering from some autoimmune disorders which might serve as a maybe prerequisite आप बोल सकते हैं, उसकी वजह से आपको frozen shoulder हुआ है. So that is another thing. Yes, if you ask me regarding then आपका MRI is something which most of the doctors would recommend अगर आपको clear findings पता करनी है कि आपको shoulder है या नहीं है. Radiographs and X-rays are not going to prove it. So that way. I hope I
Got
answered
it.
your question.
Yeah, totally. So, for example,
Yes.
I have not faced this, and that's why I did not know what exactly a frozen shoulder feels like. But today, because all of us now know, hum log sab will be able to take care of it, and just keep checking if we are facing some kind of a problem like that. Prashant, have you ever had this challenge of frozen shoulder? What is your experience around it?
Uh, yes. Dr. Pooja, can you just be a bit louder because there is some people telling that they can't hear properly. So
Yes, just
just
give me a minute, Prashant. I'll just adjust my mic again. Just give me a few seconds.
no problem, no problem. My voice is clear, right? There is no glitch or echoing and everything, right? So I will tell you. कि मेरे साथ क्या हुआ. मई मंथ में हो गया मेरा एक्सीडेंट.
Oh.
Alright, in 2022 while I was cycling. So I did not realize, but मुझे हर्ट हुआ राइट साइड पे और लेफ्ट साइड पे. वो शोल्डर पे पेन हो रहा था एंड आई अवॉइडेड. आई जनरली व्हाट वी डू इज वी अवॉइड. वी गो टू द डॉक्टर जीपी एंड वी टेल देम कि पेन हो रहा है, सम मेडिसिन आर गिवन, पेन किलर एंड ऑल. फिर हम भूल जाते हैं. तो मई में कुछ नहीं हुआ, जून में कुछ नहीं हुआ, जुलाई में पेन स्टार्टेड टू इंक्रीज अ लिटिल बिट ऑन लेफ्ट एंड राइट बोथ द शोल्डर्स. फिर व्हाट आई डिड वाज, for a correction purpose, I went to Dr. Pooja because she is like physiotherapist from a complete family. So मेरे mom मेरे सब लोग उधर ही जाते हैं. तो मैं गया वहाँ पे. लेफ्ट राइट शोल्डर्स में पेन था. डॉक्टर पूजा हेल्प मी आउट कि वो पेन को आराम देने में या कुछ करने में. बट आई डिड नॉट रियलाइज कि ओवर अ पीरियड ऑफ टाइम इट वाज गेटिंग वर्स्ट एंड वर्स्ट डे बाय डे. तो लास्ट मंथ जब लिटरली मैंने एमआरआई कराया एक लास्ट स्टेप पे जाके, तब मालूम पड़ा कि राइट साइड पे जो एडेसिव कैप्सुलाइटिस जो इशू फ्रोजन शोल्डर का होता है वो काफी बढ़ गया. दैट इज द टाइम व्हेन आई टुक दिस वेरी सीरियसली. आई वेंट टू डॉक्टर पूजा. आई कंसल्टेड हर. आई डिड नॉट इवन रियलाइज बट मेरा मूवमेंट काफी हद तक रिस्ट्रिक्ट हो गया था. मतलब राइट एंड लेफ्ट दोनों. लेफ्ट वाज स्टिल ओके बट राइट आई कुडंट मूव. इतना पेन. और उसके ऊपर से डायबिटीज, दैट्स चेरी ऑन अ केक. सो यू कैन अंडरस्टैंड कि कितना तकलीफ रहा है उस वक्त. डॉक्टर डॉक्टर पूजा कैन इवन टेल इन अ बेटर वे. डॉक्टर पूजा, है ये क्वेश्चंस काफी लोगों के भी हैं, हमारे भी हैं कि हम लोग डिफरेंशिएट नहीं कर पाते एक नॉर्मल पेन में और एक फ्रोजन शोल्डर के पेन में.
All right. So now this is a very good question which you have asked me, Prashant. I hope my voice is quite clear.
Yes, it is very clear.
Yes. All right. So see, on an OPD basis, I've been seeing patients for over 10 years now. So हमारे पास frozen shoulder के patients बहुत commonly आते हैं. Some of them are suffering from diabetes, some of them are not suffering from diabetes. ओके, अब फर्स्ट टाइम जब पेशेंट हमारे पास में आता है, ही इज कमिंग विद सम मे बी डिफिकल्टी इन मूविंग हिज शोल्डर स्लाइटली, शोल्डर जॉइंट उठाने में, हाथ उठाने में उनको थोड़ी सी तकलीफ होती है, और मे बी व्हेन वी चेक पैल्पेशन में थोड़ा सा दर्द हो जाता है. सो ऑन देयर ओन दे जस्ट नो कि हमको शोल्डर दर्द हो रहा है और हाथ हमारा उठ नहीं रहा है. सो दैट इटसेल्फ इज अ वेरी वेग वे फॉर द पेशेंट टू अंडरस्टैंड कि मेरे को प्रॉब्लम क्या हुआ है. अब अगर आप खुद से पता लगाना चाहते हैं, then I will just tell you two things. First, pain. A frozen shoulder patient will definitely have pain in the shoulder area, especially around this area. Some of them might have pain traveling downwards and in the front area as well. या फिर आपका नेक वाले एरिया में भी पेन होएगा. दिस इज अज्यूमिंग द फ्रोजन शोल्डर हैज बीन एक्टिव फॉर क्वाइट सम टाइम, ताकि वो सराउंडिंग स्ट्रक्चर्स भी अभी इन्वॉल्व हो गए हैं, सो आपका पेन दूसरे एरियाज पे स्प्रेड हो गया है. So that is one thing. And the second thing is, of course, stiffness of the shoulder joint and clear inability to raise your shoulder upwards, sideways, and of course the rotations, which is your sideward movement like this and taking it behind. अगर आपका ये सब movements restricted है along with pain, so then you are clearly into some stage of frozen shoulder. It might be an early stage, ओके, जिसमें पेन ज़्यादा होता है, रेंज लिमिटेशन इतना नहीं होता है. सो पेन माइट बी मोर देन रेंज लिमिटेशन, एंड मे बी लेटर स्टेजेस जो हम फ्रोजन स्टेज बोलते हैं, जो मेन आपका फ्रोजन शोल्डर का स्टेज होता है, उसमें पेन इज नॉट सो मच अनलेस इफ यू आर टेकिंग योर आर्म अप कंप्लीटली फोर्सफुली, तभी आपको पेन होगा. अदरवाइज द लोअर रेंजेस विल बी रिलेटिवली कंप्लीटली कंफर्टेबल. सो दैट वे, अगर आप पेशेंट हैं, प्लस अगर आप सफरिंग फ्रॉम डायबिटीज फॉर अ वेरी लॉन्ग टाइम, so this, yes, so आप you are definitely more prone to having frozen shoulder as compared to another person of your age group and or your professional and relative background who is not suffering from diabetes. Of course we'll go that in detail कि diabetes और frozen shoulder का क्या correlation है, why do they always go hand in hand. So I hope I answered your question. If you want, I can still make you understand more from a patient's point of view. And yes, of course, अगर आपको एकदम if you want to go ahead with the test, then you can approach your family physician या फिर you can approach us, of course. हम आपका एग्जामिनेशन कर लेंगे, आपको डेफिनेटली हम हमारा डायग्नोसिस बता देंगे कि आपको फ्रोजन शोल्डर है, और else if any doubt, then we will recommend you to remove a MRI scan जिसमें clearly आपका adhesive capsulitis आ जाएगा based upon the stage of your frozen shoulder. That way. Okay. All right.
Thank you, doctor, for this actually. And that brings me to the comments section. I see a couple of questions लोगों ने post किए हैं. Ma'am, please let me know if it is going to be covered later. One of the questions over here is, what is an ultrasonic massage? And the other question is, how do we differentiate between a muscular pain and a frozen shoulder? अगर हम इनमें से कोई एक अभी आंसर कर सकते हैं, because it is relevant.
Ketki, your voice is breaking a bit. All right, Ketki, your voice was breaking a bit. I hope I understood the question completely. Can you hear me?
I can hear you. Am I better audible? I'm checking my network. Am I audible for everyone now?
Yes.
Awesome. I'll repeat the question once again. हमारे पास 2-3 questions है chat box में. The first says, what is an ultrasonic massage? The other one is, how do we differentiate between muscular pain and frozen shoulder? And the third one is there a way
Okay.
to avoid frozen shoulder apart from blood sugar control? um, so इनमें से जो जो जैसे relevant होंगे I think we can answer.
All right. So let me first answer your first question. Differentiate between your muscular pain and your frozen shoulder. Now, muscular pain का जो picturization है, that is going to be totally different as compared to frozen shoulder. मस्कुलर पेन या तो आपको पोस्ट कुछ इंजरी होएगा, दैट इज वन मेजर डिफरेंशिएटिंग फैक्टर. आपने कुछ भी स्पोर्ट्स रिलेटेड इंजरी हुई है या फिर कुछ वर्क रिलेटेड इंजरी हुई है या फिर सम accidental injury has happened or some physical blow has been there to the shoulder joint. These can of course cause many various forms of muscular injuries which involve some types of tears, okay, in the muscle tissue or the tendon area. It might involve some inflammation of the tendon area as well, which many times patients present to us with. For example, supraspinatus एक यहाँ का major muscle है, so उसका अगर inflammation होएगा tendon का, so that's a totally different way the patient presents to us with. The pain is there, but other factors which are very classical to frozen shoulder, those are not there. अब अगर पेशेंट को खुद से समझना है, देन यस, लाइक आई टोल्ड यू, मस्कुलर पेन अगर हो रहा है कुछ इंजरी के बाद में, then yes, then it's most probably just a muscular pain which might recover with the first line of treatment. आप एक बेसिक जो ट्रीटमेंट प्रोग्राम होता है, आप कुछ अपने फैमिली डॉक्टर के पास जाएंगे, वो आपको मेडिसिन देंगे, आप हमारे पास आएंगे, हम उनको बेसिक लाइन ऑफ फिजियोथेरेपी करवाएंगे, कुछ एक्सरसाइजेस बताएंगे, सम एक्सरसाइजेस वी विल मेक द पेशेंट डू एक्सेट्रा. So then that will be taken care of in a very short time as compared to frozen shoulder. Now let us jump to the frozen shoulder. अब frozen shoulder अगर होएगा तो पेन के साथ में joint stiffness और मोशन का लिमिटेशन, मोबिलिटी का लिमिटेशन, दैट इज गोइंग टू गो हैंड इन हैंड. वेरेज आपका मसल इंजरी में मोस्टली आपका रेंज रिस्ट्रिक्शन नहीं होता है. मे बी यू विल गेट सम अमाउंट ऑफ पेन इन द एंड रेंज. आप अपना हाथ एकदम ऊपर लेके जाएंगे या एकदम पीछे लेके जाएंगे और मे बी वन पर्टिकुलर एंगल ओनली यू विल फील द पेन. दैट्स नॉट द केस विद फ्रोजन शोल्डर. प्लस नाइट टाइम का पेन एक परसिस्टेंट होता है फ्रोजन शोल्डर के केसेस में, because your hand has been inactive for a long time in the night hours में. So in the middle of the night you are waking up with pain, either because you have slept on that side or else आपका हाथ इतने टाइम तक stationary था, so the pain shoots up drastically in the night time. And of course it depends on the stage of the frozen shoulder, like I'm telling you. But yes, आपको जैसे ही कोई भी तरीके का muscular pain हो in the shoulder joint, plus if you are already having a blood work, for example आपका अगर sugar levels are elevated or even if in control with the diabetes medication, फिर भी अगर आप किसी भी तरीके का muscular injury हुआ है, going to take a longer time to heal. Okay, so अगर वो shoulder के आसपास हुआ है, then we cannot neglect it. So the sooner you approach doctor to get treated, the better it is, because muscular injuries might progress to frozen shoulder as well. सो पेशेंट्स कम टू अस कि आपको मस्कुलर इंजरीज हुई है, उसके वजह से आपका वो शोल्डर फ्रोजन हो गया है. सो या, सो दैट्स व्हाट इट इज. प्लस यस, मसल इंजरीज रिस्पॉन्ड टू पेन किलर्स एंड एंटी इन्फ्लेमेटरीज, और आप मसल रिलैक्सेंट्स एंड वेरी बेसिक फर्स्ट लाइन ऑफ ट्रीटमेंट से ही मसल इंजरीज नॉर्मली हील हो जाती हैं. बट फ्रोजन शोल्डर इज टफ, इट विल नॉट गो अवे इजीली. सो दैट. All right, so I'm trying not to become too technical so that everybody can understand my words.
Or thanks, Dr. Pooja. So,
Otherwise,
um, I would like to one thing. ये कॉमन किन लोगों में होता है, मतलब मेल या फीमेल, स्पेसिफिकली टेकन इंडियन पीपल इनटू कंसिडरेशन, कॉमन सबसे ज्यादा किन में होता है? ये मेल में होता है, फीमेल में होता है फ्रोजन शोल्डर का इशू?
question.
Yeah, the question is related that ये कॉमन सबसे ज्यादा किस में होता है, मेल में या फीमेल में, इंडियंस को लेके?
So see, whatever research has been published in non-Asian populations, most of the research has been published in non-Asian populations. आप वो अगर research protocol में जाओगे, then that shows कि yes, female are more prone to having frozen shoulder. That also above the age group of 40. So that is what the research studies have shown. But if you ask me, our Indian population is of the opinion there is no distinction between the male patient between the gender part regarding frozen shoulder, especially if the patient is suffering from diabetes. आप अगर डायबिटीज से सफ़र कर रहे हो, so then the gender normally is not going to play a greater role. It's the time duration. The longer you're suffering from diabetes, the more you're prone to having frozen shoulder. It is that way. And yes, now see, now currently distinguishing or filtering type 1 and type 2 diabetes and other forms of diabetes has becoming more and more difficult as the time progresses. There are many cases which are overlapping, children suffering from type 2 diabetes at a very younger age, and teenagers as well. Plus gestational diabetes भी आपका overlap कर जाता है. So nowadays it is very difficult to, आपको बहुत मुश्किल हो जाता है. You must be of course, आपको ये तो you must be having the idea regarding this as well. So yeah.
Right.
So yeah.
Yeah. That makes sense actually. Very basic question, no? Who is prone to having a frozen shoulder? So now I know that maybe it is people above 40. थोड़ा उनके chances ज़्यादा है. Of course, मतलब कभी भी हो सकता है. People who have their sugars in control, not have in control, and all of that. But I want to move to the solutioning part of it, doctor, for some time. कि what are some basic exercises या कुछ lifestyle things जो help कर सकती है हमें to make sure that या तो हमें फ्रोजन शोल्डर ना हो या अगर हुआ है तो इट क्योर्स बेटर या इजियर फास्टर. आर देयर एनी बेसिक एक्सरसाइजेस और लाइफस्टाइल चेंजेस वी कैन मेक?
Okay, now see, lifestyle changes. So yes, there are a ton of lifestyle changes which can be done so that आपका diabetes भी of course in control रहे simultaneously along with the medication. And the fact that if I speak specifically to frozen shoulder, there are many things can be done to prevent. Exercises is of course first line of management. आपको कुछ basic exercises होती हैं, they're very simple, which can be done as a precautionary measure so that tomorrow you don't progress to frozen shoulder. Now that also depends कि आपको कंधे का कोई इंजरी अभी तक हुआ है कि नहीं. If suppose you already have suffered from some form of shoulder injury, तो उसके लिए आपने क्या treatment लिया है? It all depends on that. So already if there is some form of injury happening in your shoulder joint, then the treatment program is different. Whereas if your joint is currently free and you're already suffering from frozen shoulder from diabetes, sorry, so then I recommend that there are quite some basic exercises pertaining to shoulder and neck which should be done so that your shoulder is strong enough and prepared to avoid frozen shoulder from happening in future. And yes, if you are having some other risk factors simultaneously, for example, if you're deficient in vitamin D3 or calcium or some other vitamins that have to be taken care of if you are already suffering from diabetes. That along with the fact that if you're having some other autoimmune disease which might hamper your muscle and bone tissues in future over the long run, so that has to be kept in mind towards forming the treatment program from physiotherapy point of view. So I'll not say it's that easy to answer this question, but because every patient presents with a different picturization. Like for example, now Prashant had come to me prior to with the condition of frozen shoulder. Then later on he had gotten an injury. So post that the picturization was different. So the treatment program varied in both instances. बट येस, इफ आपको डायबिटीज है, आप अभी तक आपको कंधे का कोई कंसर्न नहीं आया है, then I will definitely share some basic exercises which the patients can most certainly start from earlier the age group you can start, the better the response. And of course later on आप older age group में भी कर सकते हैं exercises. There's no age restriction in that. Younger you are, you'll be able to benefit more with the exercises. आपका age जैसे आगे बढ़ेगा, maybe some heavier forms of exercises you might not be able to do. Then your shoulder is more prone to having some micro tears or some micro trauma. So everything has to be kept in mind. I'll certainly share the exercises so that the viewers can have a look later on.
Yeah, and maybe Nupur, Rohan, Prashant can help us circulate it within the group. Maybe जो लोग आज session attend नहीं भी कर पाए, they'll also have the benefit from it. Awesome.
Right.
Prashant, would you want to move forward from here?
Yes, thanks, Ketki. So there are few questions which you have already given lights on, but again, how much time does it normally take to recover from frozen shoulder? One. And second question is, why frozen shoulder is very much common in diabetic people.
Yes. So can you repeat the first question, Prashant? Your voice
Yes.
was breaking.
No problem. So how much time does it take to normally recover from frozen shoulder issue?
So time factor, you're asking how much time it takes to recover from a frozen shoulder, correct?
Yes.
Now, first of all, frozen shoulder has got different stages. So classically we divide frozen shoulder into 3 stages. आपका जो initial pain stage होता है, which normally progresses, it might progress to maybe starting till 3 to 4 months, it might be constant. In that stage आपका pain is the prominent factor, night pain is another prominent factor, and range limitation is less. Okay, so the ranges are not yet that limited. Only the end ranges will be painful, and stiffness will be there only in the end ranges. So this is your initial stage. If neglected, the care is not taken, then it is going to progress to the frozen stage. Once the frozen stage is reached, then it might take any time between 6 months to a year to recover from the frozen shoulder from that stage. So if you are at a earlier stage, pain stage, आपका stiffness इतना progress नहीं हुआ है, आपका joint restriction इतना नहीं हुआ है, so then yes, so we assume कि within 3 to 4 months you should recover with proper exercise program, with proper treatment, and whatever precautions have been advised. It takes an effort to treat frozen shoulder. It doesn't go away so easily. Plus आपका blood work has to be strong, your sugar levels have to be maintained, your HbA1c levels have to be maintained, your vitamin levels have to be taken care of, and any other trauma अगर साथ में कुछ हुआ है, so that will add on the time frame. For example, your posture is not correct when you are working, or else if you are traveling with some additional strain, आपका day to day travel जो होता है, yeah, whatever your entire ADLs basically, आपकी जो activity है day की, if that itself is adding on the strain on the affected area, then it is going to take maybe 6 to 7 months to recover from the starting stage. So that way. Sometimes patients take more than a year also to recover, because if they present to us only in the frozen stage, तो तब तक तो restriction has already happened. So so that takes double the time to recover, maybe a year or much longer than that as well, maybe a year or 3 months or 4 months. So
Okay.
Okay, that's quite some time actually. 7 months to a year or more than that. Okay. Awesome. I think I have
yes,
one question
so
that I. Yeah, sorry. Please go ahead.
So you can ask questions. No problem.
Okay. I thought
yes.
Dr. Pooja was saying something, but fair enough. Are there other characteristics that a person should be cautious about, like being overweight, being obese? Does it add to the probability of getting a frozen shoulder? Um, or being in a very hardcore sport, for example, does it add to my chances of getting a frozen shoulder? Are there any other circumstances where we expect कि frozen shoulder होने का chance ज़्यादा है?
See, frozen shoulder can be broadly divided into idiopathic or secondary. Your idiopathic frozen shoulder does not require any injury to happen. It can be contributed to your metabolic factors. For example, diabetes. I think Prashant had asked me this question. I forgot to answer that. In diabetes, of course, the glucose metabolism is greatly hampered. So the blood sugar levels are elevated. Because of that, आपका blood का viscosity बढ़ जाता है. As a result, the healing time is prolonged for any kind of injury. That is one thing. Second thing, there is something called as कुछ end products होते हैं metabolism के जो आपके shoulder capsule पे deposit हो जाते हैं when you're suffering from prolonged diabetes mellitus. So because of that, the capsule starts getting stiffened and tightened और उसमें adhesion form हो जाता है. As a result, it restricts the limitation. It does not allow the free range of motion to the shoulder joint. Shoulder joint has got one concern regarding the congruency of the articulating surfaces. उसका mobility इतना high है लेकिन उसका stability compromised है. Okay, so because it is so mobile that you can move the arm in the varied range of motion, is the most mobile joint in your entire body. So mobility को रखने के लिए उसका stability compromise है. If for the mobility to be so good, the stability of course has to be compromised. So जो static stability है वो इतना नहीं है with the help of the bone part. Dynamic stability is something जो आपका muscle structure, आपका joint structure, आपका sorry not the joint structure, the capsule. Okay, the ligamentous structure, all these work together to provide a very good dynamic stability to the shoulder joint. So that is affected if your capsule is tightened and stiffened. Okay, plus उसके साथ में कुछ उसकी जो muscles हैं, adjoining muscles, which basically become a part of the capsule in the end. So that is those are affected. So you are not able to basically move the arm up. The capsule does not allow the shoulder to move beyond a further level based on degree of tightness. So that is the reason why if a person suffering from diabetes for a very long time and somebody who is not suffering with diabetes in the same age group, in the same working profile, maybe of the same gender as well, जो diabetic individual है उसका high chances है to be suffering from frozen shoulder than a non-diabetic person. This I am saying with regard to diabetes. Now if it's a secondary frozen shoulder, for example आपको कोई sports injury हुई है, okay, if a tear has happened somewhere around the muscle area or in the ligament surrounding the shoulder joint, post that frozen shoulder might occur. Okay, या फिर आपका हाथ immobilized है for a very long time, maybe you have recovered from a fracture of the surrounding area and your shoulder has been immobilized in a sling for a long time. Okay, because of pain or because of some reason you are not able to move the shoulder. Okay, या तो आपका healing delayed था, so the plaster or the sling had to be kept for a longer time for the bones fuse better. So these factors will somehow affect the joint capsule, leading to frozen shoulder. Then if you're suffering from some other form of arthritis, ओके, सो आपका अगर कुछ अलग तरीके का आर्थराइटिस भी चालू है बॉडी में, your blood work shows positive levels for that as well. So that is another factor combined with some injury to make you more prone to suffering from frozen shoulder. Most of the cases whom I have seen currently with the of frozen shoulder, the diabetic individuals suffering from frozen shoulder normally come to us at a very later stage. So this is something which I think I have discussed with Prashant also. वो initial stages में हमको approach नहीं करते हैं because they end up dealing with the pain part first. They just want to reduce the pain. So once the pain is reduced, they are not much worried if the hand is not, हाथ हमारा ऊपर ज़्यादा नहीं जा रहा है, that is okay for them. Pain नहीं हो रहा है, so everything is fine. So that pain management somehow delays the treatment. So this is what may be one of the reasons, and of course there are many other factors leading the patients to approach the doctor at a early stage. So that way.
Okay.
So yes, I hope I've answered. Ketki had asked me another question. I think I hope I've answered your question, Ketki.
Yeah, I wanted to know
What
if,
was your question?
obesity or anything like that plays any factor in, like, for example, people who are generally overweight, they more prone to getting a frozen shoulder, for example.
Can you repeat the question, Ketki?
Yeah. Uh, any weight management related to a frozen shoulder? People who are overweight or obese, are they more prone to getting a frozen shoulder?
Weight management. Okay, weight management you're asking. So obese individuals, you're asking whether they are more prone to suffering from frozen shoulder, from diabetes. You are asking. See,
Yes.
obesity is one of the key factors which is directly linked to diabetes. Okay, obesity is going to interfere in your metabolism drastically. So even if you are on a medication for your diabetes, आप अगर साथ में obese हो, so the fat proportion in your body is definitely much higher to another individual. So your metabolism is grossly compromised. So yes, मसल स्ट्रेंथ आपका कम है, आपकी बॉडी में फैट प्रोपोर्शन ज़्यादा है, आप ऑलरेडी डायबिटीज से सफ़र कर रहे हो, दैट इज़ लाइक ड्रास्टिक कॉम्बिनेशन फॉर द पेशेंट टू सफ़र फ्रॉम एनी फॉर्म ऑफ musculoskeletal disorder, I should say. But yes, they might have a higher chance of suffering from frozen shoulder at a younger age, especially if they are in the type 1 group, because type 1 group tend to be diagnosed with, of course, they are suffering from diabetes from a younger age group. सो आप अगर कुछ सालों से सफ़र कर रहे हो एंड साइमल्टेनियसली इफ यू आर ओबीज, then you are certainly challenging your body beyond your limits. So you have high more chances of suffering from frozen shoulder or any other musculoskeletal condition. Plus, if you are a sports player, so I think you asked me that as well. Key sports related injuries, I think you asked me. So sports related injuries are very common, in fact, because they cause micro tears in the tissues, like we told, if the patient is not taking adequate precautions. तो उनके केस में आपको इनफैक्ट थोड़ा केयरफुल रहना पड़ेगा एनी फॉर्म ऑफ इंजरी ड्यूरिंग द स्पोर्ट. If you are a diabetic individual, you cannot neglect that. It has to be dealt with immediately. But a plus point with sports individuals is that a little bit of range limitation itself is a red flag for them. So if you're playing some sport and if an injury has happened, normally they get it. They approach the doctor because that is going to limit their mobility in their game. So that's in fact something good, which I will say. It's like a positive reinforcement, क्योंकि आप वो मोबिलिटी इतना अच्छा है आपका, आप यूज कर रहे हो हमारे शोल्डर को इतने अच्छे से, so you come to know something is going wrong. Otherwise, if a housewife approaches me, she many times we ask the patients these questions कि you're having this problem since 6-7 months. आपका हाथ ये लेवल तक पहुंचा और आपको पता कैसे नहीं चला? Correct. That is something which we should come to know. If it's paining beyond this range, which is never used, I can still understand. But if the pain has progressed to this much level and not able to elevate your arm beyond this, and still you have been somehow trying to manage your ADL's trick movements करके या किसी तरह दूसरे हाथ की help लेके, so that is going to uh, delay the treatment drastically. So that
Okay.
way.
Yeah, thank you very much for that. uh, दो क्वेश्चन है बेसिकली. वन इज रिलेटेड टू द
Most
पेन
welcome.
मैनेजमेंट. Okay. And one question is related to
Mm-hmm.
related in the comment that it says ki, does it happen only in one shoulder or it can happen in both simultaneously?
Sorry, I heard the pain management. What was the next question did you ask
So
me?
first part question is the pain management. So for pain management, what happens is
Okay.
पीपल अप्रोच द ऑर्थोपेडिक डॉक्टर्स, और फिर वो स्टेरॉइड्स का चक्कर हो जाता है कि आप स्टेरॉइड्स के शॉट्स ले लो और पेन कम हो जाएगा या ऑलमोस्ट नील हो जाएगा पेन। ठीक है, दैट इज वन पार्ट अबाउट विच वी वांट टू अंडरस्टैंड। सेकेंड क्वेश्चन इज, क्या ये सिर्फ
Okay.
एक शोल्डर में होगा कि बोथ द शोल्डर्स में फ्रोजन शोल्डर के होने के चांसेस साइमल्टेनियसली हो सकते हैं?
All right. So now your first question, Prashant, regarding the pain management. Now, if a patient is having pain, हमारा बेसिक फर्स्ट लाइन ऑफ ट्रीटमेंट होता है कि हम फैमिली डॉक्टर के पास जाएंगे या हम ऑर्थोपेडिक के पास जाएंगे. ही इज गोइंग टू गिव अस वॉट एवर मेडिकेशन टू रिड्यूस द पेन पार्ट. Okay, we are not saying ki that is not right. Okay, if you are taking some over the counter medication for a very long time on your own just to curb the pain, that shouldn't be done. That is a strict no. Okay, diabetic individuals may to in fact you should be very alert. Pain management, pain medicines over the counter have to be as much as possible. Please approach a doctor and take, otherwise you will end up in that cycle in a very bad way. So once you have met the doctor, there are two options given to you. Either you come to us directly and we start with the physiotherapy treatment straight away, which is the first option I am giving you. Now, when that happens, we start with our treatment as in immediately when you come to us. Okay, we don't wait for the shoulder to progress further or the any other reason to delay the treatment. If you present to us with the starting stage of frozen shoulder, for example, the painful stage when the pain is quite high and the patient is not able to elevate the shoulder or the inflammation is too high and he or she is not able to do the exercises or our treatment is getting a little bit hampered because of the pain part. So yes, we recommend them to approach their family physician or their orthopedic to help them out with the pain management for the limited number of duration as advised. Simultaneously, our treatment goes on hand in hand. Okay.
Okay.
Now this is highly patient to patient dependent. Many of the patients, if they are very comfortable, they don't need to take any form of pain medication if they are able to tolerate the pain, manage the pain very well. So with our treatment, with exercises and other advice, whatever we give the patient for, they are able to manage the pain pretty well. And once the range improves, then the pain is of course automatically going to go down drastically on its own. Now second scenario is that the patients have neglected the frozen shoulder for a very long time. ओके, या फिर उसका प्रेजेंटेशन इतना सिवियर है, या तो बायलैटरल अफेक्शन हुआ है, दोनों शोल्डर्स का अफेक्शन हुआ है टू द एक्सटेंट दैट द पेशेंट इज नॉट एबल टू कैरी आउट हिज एडीएल्स ऑन हिज ओन. उसका खुद का काम ही उनसे करने के लिए मुश्किल हो गया है. So that stage, if the range is grossly restricted, okay, then yes, then the doctor is definitely going to recommend you to take an initial small dose of steroidal injection, okay, for the reduction in the joint inflammation and the pain. So that simultaneously sets us to the course of management along with the physiotherapy aspect. So no doctor is going to tell you to just blindly go ahead with the steroidal management straight away. अगर आपने neglect किया है, बहुत टाइम से आपको frozen shoulder है, the pain is unbearable, the range is drastically reduced, then to just get an initial push in the range and the pain part, so you might be advised to take a steroidal injection. Only thing is we have to understand that permanency in improvement is going to be only with the exercise aspect. Whether it is any other form of pain management, it is just like an adjunct treatment, okay, which is just as an accessory or help which is given along with the physiotherapy which is done. आप उसको फर्स्ट लाइन ऑफ मैनेजमेंट करके अगर शोल्डर को डिले करोगे, सो दैट इज समथिंग विच इज totally wrong. So nowadays, since the awareness is quite high, many times the patients come to us directly. So we accordingly advise them if they need to take any other simultaneous pain management. So then we guide them कि आप ये डॉक्टर को अप्रोच करिए, अपने फैमिली फिजिशियन को या ऑर्थोपेडिक को, एंड अकॉर्डिंगली वॉट एवर एडवाइस ही गिव्स द पेन पार्ट दैट यू गो अहेड and then we continue with our treatment. So that way, yes, rampant usage of steroidal injections and painkillers, I don't think any doctor is going to recommend that, because that's a short term management, that's not the permanent solution, of course. So especially for frozen shoulder, this I'm speaking specifically for frozen shoulder. There are other conditions, of course, which have to be dealt differently, but this is how frozen shoulder depicts. In fact, currently most of the doctors straight away tell the patients कि आप painkiller SOS लीजिए. So in case if it's need be during the course of your physiotherapy, only then we go ahead with an injection or painkiller in that part.
Okay, thank
Awesome.
you.
Yeah, thank you. Actually, thank you so much for that. And that brings me to a very related question to this. Ma'am, you mentioned कि अपने orthopedic doctor के पास जाइए, family doctor के पास जाइए. But what I specifically want to know is कि what role would a physiotherapist play in this whole picture? What benefit can people expect from physiotherapy? How does it impact our body positively? Thoda, if you can tell us about that.
See, I hope I voice is still breaking, but I hope I heard your question. You want me to answer physiotherapy benefit for the frozen shoulder, how it should be
That's correct.
gone ahead with. Am I right?
Yeah, that's correct.
Okay, now see, physiotherapy for frozen shoulder specifically is considered to be the first line of management. Any good doctor is going to advise you the same thing. I am not saying for rest any other condition, but for specifically for frozen shoulder part, फिजियोथेरेपी के अलावा आपके पास और कोई परमानेंट सॉल्यूशन नहीं है राइट नाउ, एटलीस्ट करंटली. Physiotherapy is a varied set of treatment. Physiotherapy includes आपका varied set of treatment plan based on how you are presenting your frozen shoulder to me when you come to me. There are some treatment modalities which need to be given to reduce and management the inflammation and pain. There are some um, muscle movement techniques, okay, some manual therapy techniques, some exercise management program which are self, some have to be monitored. There are very different forms of soft tissue manipulation treatments which we need to give to the patient, which are all hands on, which can be done everything in the clinic only. And apart from that, yes, the varied set of a strengthening program, the range of motion exercises, the postural correction pattern which is taught to the patient simultaneously, the occupation related ergonomic care to be taken simultaneously if you're suffering from frozen shoulder. And along with that, any other joint or structure if it is involved in case of prolonged frozen shoulder. So management and prevention of that part as well. So that's how we go ahead with the treatment. It greatly differs from patient to patient. Okay, it greatly differs from patient to patient, but the patient has to be quite patient in case of frozen shoulder. That's something which we tell them on the first day itself, that anything which is going to show results in a very very short duration, that is not going to be permanent or beneficial to you. So just go with the journey. It is going to take a little longer time, but you will recover 100%. So that's how it is. And yes, bilateral affection of frozen shoulder is there. You can most certainly suffer from frozen shoulder in both the shoulder joints. Mostly one is going to be more pronounced than the other, okay, based on the level of involvement. But yes, you can suffer from frozen shoulder in both the joints that way.
Awesome. It's so reassuring to hear, right? That you will 100% recover from it. I think this is one thing जो हमें सुनना बहुत अच्छा लगता है कि कभी ठीक नहीं हो सकता ऐसा कोई नहीं बोल रहा है. The fact that folks, I think this is the biggest takeaway that I am taking from here कि it's okay कि कुछ problem हो रहा है. First we should avoid. But फिर भी अगर होता है तो let's just visit our doctors, ask them what has happened, how can we make it right, exercise, take physiotherapy sessions, take medicines, control blood sugar levels mainly. And that exercise is the biggest key point, I think, Dr. Pooja, in this. And that's why I have a request on behalf of the group. I also see in the comment section, if you can help us with some exercises, and maybe if we can demonstrate today दो तीन exercises which people maybe can do while they work at their desk, या घर में लोग easily जो exercises कर सके, अगर आप हमें एक दो exercises ऐसे आज बता सके which we can perform in front of people and they can maybe practice it by their own. Can we do that?
Okay, so I think the exercises you are saying all right. Now, see how the patient is presenting to me. Based on that, we cater to the exercise program. But yes, there are a few basic range of motion exercises जो आप freely कर सकते हो. First thing is any forceful maneuvers and heavy workouts not to be done on your own if you're suffering from frozen shoulder. That I will always advise the patients. आप कुछ भी forceful movement खुद से मत करिए. Once it progresses and advised in the treatment program, only then we go ahead with it. Second thing, postural care exercises कुछ हैं जो on a daily basis you can do, whether you are sitting in front of the laptop or you're sitting in front of the PC, आप कर सकते हैं. And the third thing is of course some gentle movements, range of motion exercises for your glenohumeral joint or basically your main shoulder joint. See, it involves all your ranges. Now mainly is your rotation is restricted. Okay, this is one of your movements which we call as external rotation. So अगर आपका ये rotation movement restricted है, so then how much ever you are able to take it to the pain free range or just to the point of pain, you can very well do this movement. Few basic number of repetitions, for example 5 to 10 reps up, very easily you can do as much as your pain permits, because this is going to be quite restricted in most of the patients suffering from frozen shoulder. Okay, no major stress or no major strain to be done at the end range if you're doing something on your own, because we have not evaluated you, we don't know the extent of your frozen shoulder. So safely what you can do is just support your elbow. Okay, you can even support your elbow joint and just move it laterally in this direction. Okay, making sure you're sitting as elevated and as straight as possible. Okay, apart from that, the simple front range line of motion, okay, as much as the patient can take it up. Okay, one is this movement. Now see, these are very basic movements which I am telling you. When patients come to us with frozen shoulder, these movements we don't even consider. So because इससे आपका already existing frozen stage पे कुछ इतना result नहीं मिलने वाला है, but yes, something is definitely better than nothing. So one is this movement which you can do. Another is of course the front waist movement. Okay, same thing goes a slightly in between range में front range movement, because that is your caption plane. So we tell the patients आप ये वाली movement में भी थोड़ा mobility रखिए ये वाले angle में, and then maybe slightly in between. Okay, this angle, and then the last of course goes your abduction movement. Okay, which is your sideways, taking the arm upwards. Now when you're taking your arm upwards sideways, you can do it in 2-3 positions. For example, you can first position it with your thumb pointing upwards, and then you can position it with your thumb pointing downwards. Then it can be done thumb pointing medially, thumb pointing laterally. So in all these 4 positions where you can move your shoulder sideways. So thumb pointing outwards, then thumb is going to point to the front. It's not visible that much. Okay, I hope you got the gist of it. And the last one will be your movement behind. Okay, so this is going to be quite painful. So do not push, especially in this movement. आप हल्का सा movement कर सकते हैं if it is pain free. If any movement is quite painful, you're not able to do it on your own, please don't force yourself. Okay, otherwise कहीं आपकी injury बढ़ा दे. So this is one thing. Second thing is of course some postural correction has to be taken care of. Avoid forward stoop posture. आप जितना stoop रहेंगे आपका shoulder उतना ही और ज़्यादा difficult. It will take longer to heal. So the more straighter you are, the better it is. You can retract your shoulders and sit. Avoid protraction at any cost. Okay, you can sit tall, making sure the other ergonomic precautions are taken care of. For example, the laptop height, the desk, and your office space. That's another different topic altogether. But yes, these few things you can at least do on your own.
Yeah.
Okay.
All I'm
Heavy lift,
thinking is कि session
heavy
के
weights
बाद
to
मैं
be
खुद करके
avoided.
देखूंगी all of these because I don't know if it will pain. Like Dr. Pooja said, a
Yes.
lot of people don't
So
have that kind of movement, तो शायद पता ही नहीं चल रहा है. Uh,
yes. This is what I told. If you're a sports player or if you are an individual who has been doing some basic mobility exercises, for example, अगर आप ये basic mobility exercises में भी 2-3 महीने से कर रहे हो, and then suddenly one fine day you find कि हमारा end range में हल्का सा आज अचानक रात पेन क्यों हो रहा है. Okay, until yesterday I was quite comfortable with these basic movements which have been taught to me. Now suddenly why I'm getting the pain. So you start thinking कि suddenly why I'm getting this end range pain. कल ने कुछ किया था, maybe some injury had happened, or we will start thinking backwards कि what has caused this pain. So that itself is a big plus point. Then gradually every day if the movements which were comfortable couple of months back, आज वो मूवमेंट्स अगर धीरे धीरे हमको प्रोग्रेसिवली डिफिकल्ट होती हुई दिख रही हैं, then that is a very good factor to understand what is going wrong in my shoulder joint. So that way.
Okay. All right. Thank you very much for this one as well. अच्छा, there are two questions. Number one question है कि shoulder में pain आ रहे हैं while doing workouts, especially your shoulder press and chest press. ठीक है. शोल्डर एंड चेस्ट वर्कआउट करते वक्त शोल्डर में पेन पल्सेटिंग हो रहा है, तो वो वर्कआउट कंटिन्यू करें कि वो रोक दें एंड देन कंसल्ट अ फिजियो एंड देन स्टार्ट, व्हाट शुड बी डन?
See, chest press is a heavy workout. Okay, it is not considered a light workout. आपको अगर चेस्ट प्रेस में स्पेसिफिकली एंटीरियर शोल्डर जॉइंट पे अगर दर्द हो रहा है समवेयर अराउंड मे बी दिस एरिया, or else if you're getting pain somewhere on the joint line laterally, if you're getting pain which is maybe traveling towards to your arm, or maybe if you're doing some specific movements जिसमें आपको दर्द हो रहा है. Okay, और if you're sleeping on the right side, on your affected side, for example right है आपका, उसमें अगर आपको दर्द हो रहा है एंड यू नो वेरी वेल कि आपको चेस्ट प्रेस करने के टाइम पे इंजरी हुई है, या फिर मे बी सम अदर वर्कआउट विच यू आर डूइंग इन योर जिम, उसके टाइम पे अगर कुछ शार्प शूटिंग पेन आया है, you can very clearly make out कि during this plan of training मुझे वो sharp shooting pain आया है. So then you should completely stop doing that movement. At least I will recommend आप कम से कम ice और rest से मैनेजमेंट, इनिशियल जो फर्स्ट लाइन मैनेजमेंट हम पेशेंट बोलते हैं, लाइन ऑफ विच यू डोंट नीड पेन किलर्स फॉर दैट. आप कम से कम वो पर्टिकुलर एक्टिविटी मत करिए विच इज काउंटेड एज अ रेस्ट. आप हैवी वेट लिफ्ट्स मत करिए हाथ में फॉर एटलीस्ट अ वीक टू 10 days. Simultaneously, religiously, you can start doing icing to the affected area, बिकॉज क्वाइट पॉसिबल कहीं ना कोई टेंडन में आपका इन्फ्लेमेशन हुआ है ड्यूरिंग दैट एक्टिविटी विच हैज कॉज्ड द पेन, और मे बी something happened inside the in the capsule or the ligament or the joint structures surrounding the shoulder joint. So we don't know that. So on a safe side, आप पूरे shoulder area पे icing करो अच्छे से, maybe rest for a week to 10 days, and then resume your activity. If again it is painful, then I advise, then please come to us and we will guide you then regarding what is the matter entirely, that way.
Awesome. Thank you so much for that, Doctor. Prashant, do we see any more questions in the chat box? I think last 2 minutes hai. I also want to thank everybody. So if there are any more questions, we can quickly cover.
नो क्वेश्चन एज ऑफ नाउ. मेरा एक क्वेश्चन है. फ्रोजन
Please
शोल्डर
go.
का पेन स्विमिंग करते वक्त थोड़ा सा
Okay.
बढ़ता है, तो यू कैन नॉट डू द फ्री स्टाइल स्विमिंग, तो उसके लिए कुछ एडवाइस है क्या?
In frozen shoulder you cannot do freestyle swimming, that is what you're saying?
Yes, because
Okay,
this
so
the
you're
cuff
asking
doesn't.
me what is your question, Prashant?
So is there any alternate things for it? मतलब स्विमिंग जाएं, क्या करें वहां पे, वो जरूरी है, क्योंकि फ्री स्टाइल तो अब होगा ही नहीं, इतना पेन रहता है कि वी कांट रोटेट इट.
See, okay, now I'll answer you something. When you ask me this, I have had patients coming to me and telling कि मैम हमारा ये रेंज में पेन है, तो हम क्या ये रेंज तक वर्कआउट कर सकते हैं क्या? You understand? If suppose, for example, my pain starts beyond this range, then can we start doing workout, heavy workout up to this range, or maybe some other form of a sport activity which does not require taking the arm to the painful stage? Okay, for example, if this movement is painful, and maybe if you are a cyclist and if you are holding your arm stationary for a long time in this position, so ideally you are not reaching the pain range. Okay, you are doing your activity in your pain free range. Same thing holds true for your swimming. आप अगर फ्री स्टाइल नहीं कर रहे हो, आप कोई अदर तरीके का मोशन अगर कर रहे हो फॉर स्विमिंग, इट मे नॉट रीच दैट पेनफुल स्टेज, but still it is going to cause discomfort to the affected areas. Okay, swimming per se, since non-weight bearing act to cause any major वो खराब नहीं करेगा joint को, definitely you are going to benefit it, but that cannot be kept as a line of management कि आपका खाली उसी से range improve हो जाएगा क्या. No, that is definitely going to give some betterment in the flexibility and the joint range regarding your scapula motion and your shoulder joint movement. But simultaneously, if suppose you feel any other adjoining structures पे अगर post swimming pain आपका बढ़ रहा है, for example, then something is not going right even in that part. So we recommend the patients to avoid that. Let the range come first. आपका हमारे ट्रीटमेंट मैनेजमेंट से अच्छा कम से कम रेंज आ जाए, द मिनिमम विच इज रिक्वायर्ड फॉर यू टू बी एलिजिबल फॉर सेफली गो फॉर स्विमिंग, and then you can very well go ahead for any form of swimming. So even if that particular form is not painful, we see the patients, we determine the range, then only we advise them कि आपको you are fit to do the swimming or not as yet, because you might end up injuring some other tissues by repetitive movement of that particular part for a long time, even though you're not reaching the end range.
All right, thank you very much, Dr. Pooja. And over to you, Ketki, now, because I'm sure इतना कुछ जानने के बाद काफी लोग ऐसे होंगे जो सीधे बैठ भी गए होंगे बैक स्ट्रेट करके. They cannot just,
Yes,
they are
yes,
making sure that the
yes, most
shoulders are
certainly.
properly
I,
raised
I,
and back.
I hope. Yes, 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 yes.
Yeah, I don't know if you
All
noticed,
right.
मैं
So
खुद
I
वीडियो
hope
में.
I had answered most of your questions.
Totally, totally. Sorry, ma'am. Please complete, doctor.
Sorry, can I can't hear you, Ketki.
No, sorry. I think I interrupted you. Please complete what you were saying.
Okay, I was just saying that I hope I've answered your basic questions. Frozen shoulder is a very, very wide topic, and it is greatly different from patient to patient. बहुत डिफरेंट पिक्चराइजेशन होती है काफ़ी पेशेंट्स का. कुछ पेशेंट्स का टेक्स्ट बुक पैटर्न होता है जो हम कैप्सुलर पैटर्न बोलते हैं फ्रोजन शोल्डर का. कुछ रेंजेस ज़्यादा रिस्ट्रिक्टेड होंगी, दूसरी कम होंगी. कुछ पेशेंट्स कंप्लीटली डिफरेंट पिक्चराइजेशन से आते हैं, especially if they are diabetic and they already had some injury in the shoulder joint, because shoulder joint itself is a very complex structure. It has got multiple joints, multiple structures, and it is highly mobile. So that compromises the joint drastically in a way. Plus many other factors play together in frozen shoulder. ऐसा नहीं है कि आपको डायबिटीज है तो आपको frozen shoulder होने ही वाला है. It is absolutely not like that. So anybody can get a frozen shoulder. So yes, if you are diabetic, then I will recommend कि आपको shoulder pain को lightly नहीं लेना है. Any form of shoulder pain can progress to frozen shoulder at a faster pace, so that has to be prevented as a precautionary part as early as possible. The sooner you come to us, the shorter time interval it will take for you to recover completely. एकदम आप फ्रोजन स्टेज पे हमारे पास आओगे सेंड सो देन इट बिकम्स डिफिकल्ट फॉर अस आल्सो टू आंसर द पेशेंट्स कि आपको कितना टाइम लगेगा ठीक होने के लिए. ओके, सो दैट इज ऑल. आई एडवाइज ऑल द पेशेंट्स कि आप जल्दी ट्रीटमेंट स्टार्ट करिए अर्लियर स्टेज पे, एंड प्लीज डोंट निग्लेक्ट एनी फॉर्म ऑफ पेन इन द शोल्डर जॉइंट.
Thank you so much, doctor. This was a super insightful session, and I would actually want to say that for a lot of people like me, I will agree that I will admit कि मुझे नहीं पता था that there is something called frozen shoulder, and that I need to take care of myself to ensure कि मुझे ये ना हो. And I think exercising, having a good posture, ergonomic care is one more motive. I have one more motivation now to make sure that I take care of all of these things. So really, thank you very much. Thank you, Prashant, for co-hosting this so well with me and organizing this. But I would actually want to extend a few thank yous in this. All the audience, we are actually over time. 5 minutes ज़्यादा हो गए session के, but आप लोग अभी भी रुके हैं. And I think this is one of the sessions जहाँ सबको बहुत questions थे. People wanted to know कि क्या हो सकता है, क्यों हो सकता है, क्या कर सकते हैं. So this has been a very interactive session according to me. Thank you everyone for joining in the session. Thank you Nupur, Rohan, Prashant, whoever helped us coordinate this. But I would actually want to take a minute to say that Blue Circle Diabetes Foundation, of which we all are a part of, we conduct these sessions every Sunday 5 p.m. It's been 2.5 years we've been doing this, and I think more. Today Nupu was telling me कि the foundation has done more than 150 sessions on different topics, and I think that's a brilliant thing to do. We are a community of different kinds of people with different kinds of diabetes. We come together, we understand each other, help each other out, and one thing which this is a very good time to do is we are in December and we have our calendar out, that is a Blue Circle Diabetes Foundation ka calendar. I actually have one I had ordered. So I have the stickers and calendar. We have 12 different people who are dealing with and living with different kinds of diabetes. You can see some familiar faces also on the calendar. Please do order it from. There's a link that's been posted on our community page. We do a lot of regular catch-ups in different parts of India. So please please stay connected. Please reach out for any kind of support. And thank you so much for joining in today.
Thank you very much. Thanks a lot, Dr. Pooja, for removing time on Sunday especially.
Thank you
Thanks.
so much.